welcome to another Prime Time of Life Health Education Workshop. It's so nice to have you all here. We're going to go through a very quick overview of metabolic health with a specific focus on insulin resistance and type 2 diabetes. So, before we get started and delved in too much, it's important to understand what insulin is. So, insulin is a hormone that is released from the pancreas. So that's a really small organ in the abdomen, and that picture there on the right just helps to for you to visualize where it actually is. And the role of insulin is that it is needed to move glucose into the cells in our body to be either used or stored as energy for later use. So what happens to our body in terms of blood sugar control? So we always have a certain amount of blood sugar and insulin in our bloodstream. And normally, after you eat, some of the food is broken down into glucose, which is also known as blood sugar, and it's transported through the body in the bloodstream. So, for example, if you had toast for breakfast this morning, which is a carbohydrate, your blood glucose levels will rise. So you'll see at the point where the arrow is at breakfast, it's rised up to then. So when this happens, the normal response of the pancreas is to produce and release insulin to decrease blood sugar back to the normal range. So you'll see here, it's a similar pattern. Okay, and this will happen again if, for example, you had pasta for lunch, which is high in carbohydrates. Again, it'll rise, our pancreas will kick in, release insulin, and blood glucose will drop again. So it just shows here that our glucose and insulin levels will fluctuate during the day. Now, we generally try not to get too focused on science and mechanisms and everything when we speak about insulin resistance and type 2 diabetes, but I think this diagram really helps to visually explain what's happening in our body. So this here is a cell in the box, and specifically it's a muscle cell. So if I eat toast like I did this morning and it's broken down, our blood glucose levels rise, or our blood sugar levels will rise, and our insulin will be produced to regulate that. So what happens then is our insulin will bind to the receptor on the outer surface of the muscle cell, and this causes a big cascade, lots and lots of downstream signaling. But specifically, there are sugar or glucose receptors in our muscle cell. And what happens is when insulin binds to the receptor, it signals for those glucose transporters to move towards the lining of the cell or the cell surface to bring that glucose into the cell. So this helps to reduce blood sugar or blood glucose levels in the bloodstream and keep blood glucose in the normal range. So it brings it in for our cells to use it. But the problem is that unfortunately, if we have insulin resistance, pre-diabetes or type 2 diabetes, this sequence of events does not work very well, and it means you have trouble regulating your blood sugar levels, and they can therefore continue to rise. So insulin resistance occurs when the body can no longer use insulin that it produces. So our cells become resistant to the action of insulin. Now, as we just mentioned, insulin normally allows glucose to enter the cells for the body to provide energy, but with insulin resistance, the glucose or sugar will remain in the blood. And what we find with the progression then to prediabetes and specifically type 2 diabetes is the body's ability to produce insulin decreases over time. So pancreas production of insulin decreases, which further contributes to an elevation of blood sugar levels, which is not good. So what does this mean for our health? So as we said, if you can't regulate your blood sugar levels, they'll continue to rise. So what we say to people commonly is to know your numbers. If you are going to your GP specifically to look at your blood glucose or plasma glucose levels, you would get a fasting blood sample commonly taken. And you'll see on the chart I have normal on the left-hand side, pre-diabetes in the middle, and type 2 diabetes on the left-hand side. So really we need your fasting glucose to be under 5.6 millimoles per litre to be considered normal. If it goes above that, so 5.6 to 6.9, it's pre-diabetes. So this is a condition where your sugar levels are higher than normal, but it's not enough for a diagnosis of type 2 diabetes. And then if it goes beyond 7, it's considered type 2 diabetes. On the second line then, there's 2-hour plasma glucose during OGTT. And what this is an oral glucose tolerance test. And it's another test that's commonly provided in Ireland, and women often get it when they're being tested for gestational diabetes. So with this test, your GP would look at your fasting glucose and your 2-hour plasma glucose concentrations. Because what happens is you take a fasting blood sample, you take a glucose drink, and then your blood samples are taken every 30 minutes for 2 hours. And basically it looks at how your body can control your glucose levels. And finally then, another thing that your GP might look at is your HbA1c level. And this is, again, checked in a blood test, and it provides information on the average level of blood glucose or blood sugar over the past 3 months. So ideally, you would like this to be lower than 5.7% or 39 millimolars per mole. Okay, so them slides can be provided to you, but just so you know, when you go for a blood test, this is what your number should be. So just to give some risk factors then, so there are a number of risk factors that contribute to insulin resistance, pre-diabetes and type 2 diabetes. But the good news is some of these are modifiable. So there's things that we can do to prevent this. The first risk factors there are physical inactivity and high levels of sedentary time. So physical inactivity is not achieving the recommended guidelines for physical activity. So that's 150 to 300 minutes of moderate intensity aerobic exercise per week. So if you're not meeting them, you're considered physically inactive. And high levels of sedentary time then would be accumulated hours either in a sitting, reclining or lying position. So essentially it's you're not moving your muscles enough, and it will not help to control your blood glucose levels. The next one then is a chronic high sugar, high fat, energy dense diet. So this is like the chronic consumption of takeaways, sweets, biscuits, sugary drinks, and they'll all cause problems for the insulin signaling mechanisms. But we can modify this, and if we do, we can help treat and manage this condition. The third risk factor then is excessive body weight, particularly in the abdominal region. And this has a huge impact on metabolic health. So part of the reason is because our fat or our adipose tissue can infiltrate our tissues of metabolic importance. So like our liver and our skeletal muscle. And this can cause the production of pro-inflammatory or health deterrent biomarkers, which can contribute to this progression to type 2 diabetes and cardiovascular disease. But if we modify our diet, reduce our sedentary time and increase our physical activity, we can actually shift this to produce anti-inflammatory biomarkers or health enhancing biomarkers that contribute to the improvement in our health. So again, modifiable. And then the fourth one then is other health concerns can also contribute. So our high blood pressure, high cholesterol, low HDL cholesterol, also known as our good cholesterol, and high circulating triglycerides. One of the factors that's not modifiable is our age, because we all know that we will get older. And generally as we age, particularly over the age of 45, we can start to become insulin resistant, particularly when compounded with physical inactivity and high levels of sedentary time. So it's like physical inactivity and sedentary behavior associated with age, so not age specifically. And the next unmodifiable one then is our family history. So if you have a close relative with type 2 diabetes, such as a parent, a brother or sister. But this just means your risk of getting type 2 diabetes is elevated, but it is not inevitable. So you really, really need to pay attention to your physical activity, sedentary behavior, and nutrition to mitigate this increased risk. So the great news is that if you have insulin resistance, pre-diabetes, and type 2 diabetes, your insulin mechanism doesn't work very well, but you have another or standby mechanism, which is this muscle contraction. So muscle contraction, whether it's during walking, squatting, climbing the stairs, or doing our exercise classes, it's stimulating what insulin does. So it tells the glucose transporters to move to the cell surface to bring that glucose or sugar into your cell. So it helps to decrease these circulating glucose or sugar levels. So we would commonly ask anyone with type 2 diabetes to monitor their blood glucose levels before and after a training session. And this helps to look at the individual's metabolic response to exercise. And what we can find commonly is that before class, it might be 8 millimolars per litre, and after class, it could be 7 millimolars per litre. So muscle contraction is so important for keeping us metabolically healthy. So now for some specific exercise recommendations for uncomplicated type 2 diabetes. So this means type 2 diabetes without enhanced risk from other things like retinopathy and things that I will talk about in a few slides on. But aerobic exercise daily if possible. So daily, moderate intensity aerobic exercise. The talk test, so that's considered moderate if you can talk okay while you're exercising. Again, trying to get that 150 to 300 minutes per week, or you can make that up of shorter and accumulated bouts. So walking, cycling, dancing, water aerobics, they are all aerobic. And the great thing about aerobic exercise for diabetes is that it increases glucose use and storage in skeletal muscle, which in turn regulates glucose levels. And it also increases your ability to use your fat stores, which improves them insulin signaling mechanisms as well. The second type of exercise then is resistance exercise, which is recommended 2 to 3 days per week, low to moderate to start with, and building up to moderate and beyond. So if you're on our primetime program, you are meeting these guidelines by training with us. And what resistance training does is that it increases muscle mass, which therefore increases the storage space for glucose. And it also enhances muscle function. So you're increasing your metabolism of glucose and lipids, so fats. And it's also so important for preventing sarcopenia and dynapenia, which is the loss of muscle mass and strength associated with aging. So really important. The other two types of exercise, which we've talked about in other workshops, are flexibility and balance. So I'm not going to go into these specifically today, but they are so important to your overall health, functionality, and quality of life. But today I really just want to highlight the benefits of aerobic and resistance training specifically, and that is exactly what you are doing in the Prime Time of Life exercise classes. So just some important recommendations as well. So try to not allow no more than 48 hours between exercise sessions. And the reason for this is you will lose the beneficial effects of muscle contraction after 24 to 48 hours. So if you can, please try to do some physical activity daily. If weight loss is your goal, a reduction of 5% first, which can be then increased to 10% of body weight, has a significant impact on your health, and it will help to improve your insulin resistance and metabolic health by impacting your sugar levels, cholesterol levels, heart health, and so much more. So if weight loss is your goal, 5% first. As I mentioned, reduce your sedentary time as much as you can. So even breaking it up with little bouts of exercise. We do the boil the kettle challenge. So we do squats while we're boiling the kettle sometimes. And even those small things throughout the day, I know I drink 5 cups of tea a day at least, so I can get a good few squats in. But for adults who are overweight, They recommend that sitting should be interrupted by brief, less than 5-minute bouts of movement every 30 minutes to improve blood sugar control. And for adults with type 2 diabetes, it is recommended to have a 15-minute walk after eating to help regulate blood sugar levels. So moderate intensity talk test, just a nice brief walk. The next one then, so you may need medical clearance for exercise. So please speak to your GP if you do. This does not apply to anyone on our current Prime Time of Life programme, as you have all been medically screened by our clinical exercise physiologist. But just for anybody who is listening to this back, please check with your GP beforehand. Also, just to please note that there are very specific exercise recommendations for the complications of type 2 diabetes, which I just mentioned briefly. So that would be like our retinopathy. So that's high blood sugar levels damaging the back of the eye. Our nephropathy, which is deterioration of kidney function, and our neuropathy, which is our damage to our nerves, and that can be peripheral or autonomic. So if you are experiencing any of these, please consult your GP or a clinical exercise physiologist. And also, if you have any foot injuries, including ulcers or serious illnesses or infections, again, please consult those people too. In terms of drug treatment, so please make sure that your diabetes is being managed appropriately with your GP if you have it. But just to highlight that if you are injecting insulin, the timing of those injections is really important, and you need to avoid injecting insulin into exercising muscles, because these together will allow for a double insulin lowering effect. So you have insulin decrease in blood glucose levels, but also the lowering effects from muscle contraction. So that can lead to really low blood sugar. So please be just wary of that. The last point on this slide then is pre-exercise blood glucose. So if you have diabetes and your pre-exercise blood glucose is lower than 5.5 millimolars per litre, you need to be careful because they will drop as you're training, and you don't want to go into that hypoglycemia, the low blood sugar. So you may need to take some fast acting carbohydrates beforehand, so like our crackers, our toast, and things like that. And just a note for everybody, please have your phone with you when you exercise, just in case. And that is not only if you have type 2 diabetes, but for everybody. So just some final ones then. So I know I've been saying that our exercise can reduce our blood sugar levels, but there is some instances where high intensity exercise can result in hyperglycemia, which is our high blood sugar. And there's numerous reasons for this, which one of them could be uncontrolled diabetes. But a second one is that the liver can start releasing glucose into the bloodstream because it notices that the body needs glucose to fuel exercise. So there is no need to be in the high intensity zone if you have type 2 diabetes. And if you are experiencing this, we would really recommend that you reduce the time and intensity of exercise you're engaging in. And if you're unsure of where you are at in terms of intensity, please go back to the first workshop that we did on exercise intensity. Again, just a reminder, please check your blood sugar levels before and after training sessions, particularly your first few, to understand your metabolic response to exercise, and it should lower. And just a quick note on hypoglycemia. So it is important for you to know that blood sugar levels will continue to be lower in the minutes and hours post-exercise. So this is called post-exercise hypoglycememia. And this can happen to anyone, not just those with type 2 diabetes. So please be aware that this can happen, especially if it's a long time since you have eaten. So try to avoid that as much as possible. Also, a late night training session can result in low blood sugar during the night. So you need to make sure you don't go to bed without eating. So this could result in a serious hypoglycemic episode in the night, which is dangerous for type 2 diabetics, but dangerous for everybody. So please, if you're type 2 diabetic especially, please check your sugars before you go to bed, and you may need a snack. And again, just because it's important for everybody, just to recognize symptoms of hypoglycemia. And we've discussed some of the causes there, but it can be too much insulin injected into the exercising muscle, too little carbohydrates beforehand and missed meals or a long time since your last meal, excessive exercise, very high intensity exercise, or poor glucose control. So again, it can happen to any of us, but just to list a few here, we have shakiness, weakness, abdominal sweating, heart palpitations, nervousness, anxiety, tingling in the hands and fingers, and hunger. There's also additional ones of headache, visual disturbances, mental dullness, confusion, and serious ones, seizures and comas. So if you're experiencing any of these during or after training, you really need to track your physical activity and nutrition and see where the balance is. And if you need to, please consult your GP. And if you need any exercise advice, please contact the clinical exercise physiologist. So that is a quick run through of metabolic health there. I hope it was okay. And if you have any questions, please let me know. But thank you again so much from your time. And I hope that you learned something this evening. Thank you.